Hello all, very good morning. In today's class, I would like to discuss you regarding the topic dengue. So coming to the dengue here, I'm going to discuss mainly regarding the community aspect, not with the pathological or clinical aspect. So we'll see clinical aspect, but it is in very little. So coming to the topic here, coming to the introductory part. So Mr. Qin dynasty. So mainly in the era of 265 to 420 AD. So he has referred this dengue fever as a water poison. So it is mainly associated with the flying insects. So here mainly the first case of dengue fever, it has occurred in the Vellore mainly in the year 1956. And the first case of dengue hemorrhagic fever, it has occurred in 1963 mainly in Calcutta. So we have dengue fever and we have dengue hemorrhagic fever. Dengue hemorrhagic fever, it has occurred in 1963, and dengue fever, the first case was discovered in Vellore mainly in the year 1956. So coming to the introductory part here, so it is an acute virus. So suddenly you can see the signs and symptoms. So this is an arbovirus disease. So it is causing us a severe and flu-like illness. So when a person is experiencing flu, the person body will be disturbed and suddenly the illness will become very severe. In same way, when a person is affected with dengue, it is mainly focusing on the circulatory system. It is mainly focusing on the person's body, so that the person is becoming very ill in nature. So it is mainly transmitted with the infective bite of Aedes aegypti mosquito. So with this you can know the organism is Aedes aegypti mosquito. So here the person, whenever a human being is bitten by an infected female Aedes aegypti mosquito, so when the person is getting an bitten, after 5 to 6 days of being bitten by the infective mosquito, the man is developing the disease here. So it is one of the complex disease, and it is having very wide spectrum of clinical presentation. And dengue fever, it is self-limiting disease in majority of the cases. So it is a very wide spectrum disease, and it is having different types of clinical presentation. The person will have abdominal pain, the person will have fevers, the person will have rashes on his body, and you can even observe the petty and you can observe even the bleeding manifestations also. So it is just like a symptom, and in severe case even you can observe the orbital bleeding, internal bleeding may be present, or arachnoid hemorrhages may occur. So this is a very wide spectrum disease, and it is having different types of clinical presentations. So coming to this, you have this iceberg or pyramidal phenomenon. So we have dengue syndrome, we can call it as dengue fever or dengue hemorrhagic fever, where you can observe the person is having hemorrhages in the body or even the external, and some of the cases, so majority of the cases according to this they remain asymptomatic, and medium cases they are being shown, and dengue syndrome you can see very less here. So this is the dengue virus manifestation. If you see the global scenario, so it is an endemic, so it can occur in tropical areas, it can even occur in the subtropical areas, and there are as many as 125 countries that were affected with this dengue endemic. And if you see, it is mainly occurring in the Southeast region, and they have seen major spike mainly after World War II. So there are several epidemics that has occurred since 1980s. So here the pandemic, it is mainly began in the Southeast Asian region mainly after World War II, and from then they have experienced, from 1980 they have experienced so many epidemics, and the distribution, it is always comparable to the another mosquito borne disease, malaria. So if you see here the dengue cases, so per an year there are nearly 390 million dengue infections that are occurring, and you can, in those things you can observe 96 million cases that were clinically manifesting. So as I am discussing, majority of the cases they remain asymptomatic. So there were about 390 million cases that has reported, and in those only 90 million were showing clinically manifestations. So in those 90 million cases, it can be dengue hemorrhagic fever or it can be dengue syndrome. So in such a way it is being manifested, and if you see about 5 lakh cases About 5 lakh cases with dengue, severe dengue, they are requiring hospitalization, and in those 5 lakh cases, majority of the persons that being affected are the children. Majority of them are children, and about 2.5% of those who got affected with this dengue fever, they are dying. So this is the global scenario of dengue fever. Coming to the Southeast Asian region, so we have category A, we have category B, and we have category C. So in category A, we have Bangladesh, Sri Lanka, India, and Indonesia. In category B, we have Bhutan and Nepal. And category C, we have South Korea. So this category C, so there is no evidence of endemicity here. But in category B, you have endemicity, but they are very uncertain. But coming to the category A, Bangladesh, India, Sri Lanka, and Indonesia, there it has become a major health problem, and it is one of the leading cause for the individuals to get hospitalized, and it is causing death among the children. So you can see it is leading cause, and it is causing death for the children, and it is hyper endemicity with all 4 types. So in all 4 countries it is showing hyper endemicity, and it is spreading to the rural areas also. So if you see here, hyper endemicity with all 4 types means here in dengue fever we have 4 serotypes: dengue 1, 2, 3, and 4. So all these 4 serotypes are showing hyper endemicity here. So mainly it is occurring in Southeast Asian region. So when it started to occur mainly after the World War II, and mainly they have experienced from 1968, they have experienced a lot of epidemics in this Southeast Asian region. So this is the distribution of dengue around the world. You can get this picture from the World Health Organization website. So this red is indicating the cases more than 1 lakh cases per an year, and this light red is indicating 10,000 to 99,999 cases per an year, and this color it is indicating like 1,000 to 10,000 cases per an year, and this light red it is indicating less than 1,000 cases per year. These white regions indicate no cases, and the regions like South Africa, these continents, they are showing not showing any kind of data. So this is the distribution of dengue around the worldwide according to 2016. This is from the website WHO. So dengue cases that were notified from 1990 to 2015. So you can see these are all the cases that were notified, and these are all the southeastern region. Coming to the national scenario of this dengue fever. So as we are discussing here, the first outbreak it has recorded in the year 1812, and the double peak of dengue hemorrhagic fever epidemic, it has occurred in the Calcutta. So it has occurred between 1963 July to 1964 March. Mainly the double peak of this dengue hemorrhagic fever epidemic, it has occurred in the Calcutta, that is from July 1963 to March 1964. And in New Delhi, the outbreaks of dengue, they had occurred in 1967, 1970, 1982, 1996, 2005, 2010, and 2015. This is mainly because of rapid urbanization, lifestyle changes, and poor water management. So the cases reach peak in monsoon, mainly in Gujarat and South India perennial regions. Why it is reaching in monsoon means, for female this Aedes mosquito, they breed mainly on the water. Even it is small water or it is a big amount of water also, they feed on the water. So the breeding habit, because of the breeding habit of this Aedes mosquito, they are mainly increasing in number in the monsoon region, because the water stagnancy is remaining everywhere because of the poor drainage system that is present in our India. So there is increase in the dengue cases, and the endemic states in it is endemic in nearly 31 states including the union territories. Coming to the dengue or dengue hemorrhagic fever distribution in India, so it is prevalent throughout the India, and it is mainly occurring in metropolitan cities as well as towns. So outbreak have also reported in the rural areas such as Haryana, Maharashtra, and Karnataka. So these are all the areas where you can observe this dengue. So since 2015 to 2018, I have the data. So number of cases and number of deaths. So in the year 2015 we have like 99,913 cases, nearly 1 lakh cases, in which 220 deaths has occurred. In 2016 it was like 1,29,166 cases, in which 245 deaths had occurred. In 2017 it was 1,88,401, in which 325 deaths had occurred. And in 2018 till 22nd July 2018, about 14,223 cases had occurred, in which 30 of them infected cases were reported as death. So coming to the epidemiology, so as we are discussing, as I have said, dengue fever, so it is mainly of 4 serotypes, 1, 2, 3 and 4. It is a single stranded RNA virus, and it is in the family of Flaviviridae, and it is at the size of 50 nm in nanometer, and it is antigenically similar, and cross protection is only for few months. So once a person is infected with one serotype of infection, here the lifelong immunity occurs to the serotype. So here the first infection, it sensitizes the patient. In second infection with different types of serotypes, so it forms an immunological clusterotroph. Once you got infected with any one of the serotype, you will get immunity for lifelong with all the 4 types of serotypes. So here if you see, it is Aedes aegypti mosquito. The vector is female mosquito, as we are discussing. It is Aedes aegypti mosquito, and it is a small in size. The size is about 5 millimeters, and it is a black mosquito with white stripes. So I will show you. You can see it here. So it is a black mosquito with white stripes. So this is how the mosquito will look like. So we are discussing regarding the epidemiology, and we have seen regarding the vector here. So here it is high vectorial in competency, and multiple cases and clustering of the cases are seen. So mainly they are highly domestic, they are strong anthrophilic, they are nervous feeders, and they are discordant feeders. So Aedes aegypti mosquitoes, these are small. As we are discussing, there are different types of aegypti mosquitoes. So we will discuss one by one. We have seen regarding the aegypti. It is small, 5 mm in nanometer, by black mosquito with white stripes, and it is mainly seen in the urban areas. And we have Aedes albopictus mosquito. So it is an aggressive feeder, and it is concordant species, and it is mainly seen in the southern India. Coming to the life cycle of this Aedes mosquito, so here the adult, it feeds on the human, and it lays the eggs. The eggs will develop into larva within 2 to 3 days. After 2 to 3 days, again the larva, after 4 to 5 days, it will become a pupa. From pupa, again it is developed into the adult mosquito. Again it is infecting the human beings, it is sucking blood, it is laying the eggs, again it is becoming larva. So in such cases, the life cycle of Aedes mosquitoes will takes place. So mainly we have 2 species, Aedes albopictus, we have Aedes aegypti mosquito. So coming to the feeding habit of this Aedes albopictus, so it feeds on the day. So it is a day biter, and it bites repeatedly. So coming to the resting habit, so it rests in domestic as well as peri-domestic areas, and it mainly rests in dark corners, and it rests on hanging objects like clothes, umbrella, and under the furniture. And breeding habits, so any containers which are having even small quantity of water, so there you can see the breeding habits. And the eggs of Aedes aegypti mosquito, they can live without water for more than 1 year. So even whenever the mosquito has laid the eggs, even there is no water also, they can live for more than 1 year, and whenever they find the water, they can grow into an adult mosquito. That's what the endemicity of the disease is very high. So as we are seeing, these are all the favored breeding sites. So the leftover coconuts with water, the plastic and the drums, open tanks, open tires that were filled with water, and open pots or coolers, and the drainage areas. So these are all the areas which are favoring the breeding for this Aedes mosquitoes. So coming to the host here, so man is the reservoir of this virus, and monkey is the jungle reservoir in Malaysia as well as Africa. So both sexes, either it is male or female, it is affecting and it is occurring in the all age groups. So coming to the mode of transmission, it is transmitted to human by the mosquito bite, and mosquito, it remains infective for the lifetime, and trans ovarian transmission also it is occurring. So infected person can't spread the infection, but when a mosquito is coming and biting, but sources but can be a source of virus for mosquitoes for 6 days, means here the infected person with dengue, he cannot spread the infection, but when a non-infected mosquito is coming and biting the infected person, again the infection is being transferred to the mosquito and he can spread the infection. So the incubation period is about 3 to 10 days. Commonly it is 5 to 6 days. That's what we can see the person getting infected after 5 to 6 days. So coming to the environmental factors here, so it is very distinct in seasonal pattern. Mainly it occurs, it reaches high in the rainy season because the water has stayed everywhere, and it breed artificially collected waters also, where the discarded flower pots are there, or old drums or water containers. So it is endophagic and endophilic. So here the lifespan, it is influenced by the temperature. So 16 to 30 degrees Celsius and humidity 60 to 80%, they will favor the lifespan of this mosquito, and increased temperature will increase transmission of the disease. Coming to the risk factors here, so construction activities where the water storage practice is not in a proper manner, population movement, heavy rainfall, and vector abundance. So these are all the risk factors that favor the female Anopheles mosquito, female Aedes mosquito breeding pattern. So here factors that favor for dengue epidemic are strain of a virus influencing the magnitude and duration of viremia, and vectorial capacity of the vector, and susceptibility of the human population. So either it is genetic or immune, and introduction of virus into the receptive community. So severity of the dengue hemorrhagic fever, it can be seen with dengue serotype 1 or 2 or 3 or 2 or 4 or 2. So here the second serotype is very danger. Coming to the dengue virus infection, so it remains asymptomatic. If in case it is symptomatic, you can see them undifferentiated fever, you can observe dengue fever or dengue hemorrhagic fever, or it can turn into dengue shock syndrome. So this is the dengue virus infection. Coming to the classic dengue here, if you see classic dengue fever, so it starts with acute febrile illness, and you will have headache and retroorbital pain. You can observe myalgia and arthralgia. You can have breakbone fever. So high fever will be there for 5 to 7 days, and second fever, it will be there for 1 to 2 days in 5% of the patient. So once the dengue has affected, you will have fatigue. So the fatigue can last from days to weeks, and classic dengue, it is about 15 to 60% of the dengue infections that are occurring, and you can have nausea, vomiting, and diarrhea in 30% of the cases, and macular or maculopapular rash can be seen in 50% of the patients. As it is a flu-like symptom, you can observe even the respiratory symptoms also. You can observe cough and sore throat in 30% of the infected cases. So dengue fever with probable diagnosis and confirmed diagnosis. So acute febrile illness with 2 or more following, means if the patient is having headache, retroorbital pain, myalgia, arthralgia, rash, hemorrhagic, leukopenia, and thrombocytopenia, and raising PCV. And if they are having this supporting serology on single sample, means comparable to IgG or IgM negative, if they are IgM, if they are having this positivity, so the occurrence at same location, time as confirmed case will show you it is dengue fever. And confirmed diagnosis is like, so isolation of dengue virus from the serum or cerebrospinal fluid or autopsy, and 4 into more increased serum of IgG or IgM antibodies, and detection of this dengue virus or antigen tissue or serum or cerebrospinal immunohisto or ELISA. So whenever you go for this diagnosis, and if you find the detection, you can say it is confirmed. Detection of this dengue virus genomic sequence by RT-PCR test. So this is the diagnosis. based on the signs and symptoms, and if they are having IgG or IgM positive, then you can say the person is having probably dengue fever. If you can confirm the diagnosis when you are directly detecting the genomic serotype, or either using the ELISA test, or 4 times increase in the IgM or IgG antibodies. So coming to this dengue hemorrhagic fever, so according to WHO, the thrombocytopenia means platelets becoming less than 1 lakh and fever that is staying for 2 to 7 days, and hemorrhagic manifestations with positive tourniquet test, and hemorrhagic hemoconcentration or evidence of plasma leakage. So all these things will define you that the person is having dengue hemorrhagic fever. Coming to the signs and symptoms of dengue hemorrhagic fever and shock syndrome, here symptoms are very similar to the dengue fever, but it is severe with stomach pains and skin become very pale and the person become cold and clammy. So you can observe epistaxis, nothing but bleeding from the nose, bleeding from the gums and skin rashes, and frequent vomiting with or without blood. There will be sleeplessness, restlessness, and patient feels thirsty and mouth becomes very dry, and you can observe rapid weak pulse and difficulty in breathing. So these are all some of the signs and symptoms of dengue syndrome. So these are the classification and grading of severity. So you can say the person is having dengue, classical dengue fever, when the person is having this headache, retroorbital pain, myalgia, arthralgia, rash, hemorrhagic manifestation, and no evidence of plasma leakage. Here the leukopenia can be seen. It can be less than 5,000 cells per cubic millimeter, and thrombocytopenia can be seen. The platelet count will be less than 1,50,000, and if you see the raising of the hematocrit, it will be like 5 to 10%. If it is dengue hemorrhagic fever 1, so all the above criteria, all the signs and symptoms will be present, and you can have the positive tourniquet test, and you can have the evidence of plasma leakage. Here the platelet count is less than 1 lakh, and hematocrit it will raise up to 20% or even more. In type 2, means in severity 2, here all the above signs will be present, and you can observe spontaneous bleeding from the skin, even organs. You can observe the black stools, you can observe epistaxis, means no bleeding from the nose, bleeding gums, and etc. So here also the thrombocytopenia will be less than 1 lakh and hematocrit is more than 20%. And if it is type 3 dengue fever, you can observe all the above signs and symptoms with circulatory failure. So you can have weak rapid pulse, and the pulse pressure will be less than 20 mmHg, or even high diastolic pressure. You can see hypotension can be observed, and you can feel the person cold and clammy skin, and restlessness can be seen. And if it is type 4, grade 3 profound shock will be observed. So here undetectable blood pressure and pulse can be seen. So this grade 3 and grade 4, they are the dengue hemorrhagic shocks. So this is WHO classification and grading of severity of the dengue fever according to the WHO. Coming to the period of communicability, here the infected person with dengue become infective to mosquitoes for 6 to 12 hours before the onset of disease, and he can remain infective up to 3 to 5 days after the mosquito has bitten. Means once the mosquito has bitten, that is from 6 to 12 hours before the onset of disease, the person remains infective, and once the onset of disease has occurred, he remains infective for another 3 to 5 days. Coming to the laboratory diagnosis, we have virus isolation, we have RT-PCR, we have antigen detection test like ELISA or dengue NS1-AG, and we have immunoserological tests, so hemagglutinin inhibition or complement fixation test CFT we have, or neutralization test we have IgM capture enzyme linked immunosorbent assay MAC ELISA recommended, and we have IgG ELISA, and we have rapid diagnostic test, and we have hematological parameters. We have even the hematological parameters such as platelet count and hematocrit. Mainly you will see what is the level of platelet count. Once the platelet count is becoming less than 1 lakh, if it is going to 40,000, 20,000, then you can say the person is having this thrombocytopenia. Automatically the person will be positive for dengue, and you have to correlate with the other types of diseases also. So these are dengue diagnostic sample and characteristics. Coming to the management, here if you see, whenever you find an early case, even it is in the community or it is in the hospital, you should report the suspected dengue fever, and there is no specific therapy. So here management for the dengue fever is symptomatic and supportive. The patient is advised to take bed rest during the acute phase, and you should use cold sponging for the temperatures that is above 39 degrees Celsius, and antipyretics may be used mainly to reduce the temperature. And aspirin means NSAIDs should be avoided mainly to avoid this gastritis, vomiting, acidosis, platelet dysfunction, and Reye's syndrome. In dengue shock syndrome, mainly what are all the plasma that has been lost, we have to replace that. You have to correct the electrolyte and metabolic disturbances and blood transfusion if needed. Coming to the indication, so red cell transfusion is needed when the total blood volume is less than 10%, and if you see refractory shock despite fluid administration and declining the PCV, and if fluid is overloaded, you have to go for the packed cells. Coming to the platelet transfusion, if it is less than 10,000 cubic cells per millimeter, then you have to go for platelet transfusion, and prolonged shock with coagulopathy and abnormal coagulogram. So these are all some of the indications. So with this, I would like to end the topic here, and we'll see prevention and control in part 2 section of this video. I hope you understood. If you have any difficulties in understanding, please let me know. And if you like the content, please like, share, and subscribe the channel. Thank you so much. Thanks for watching and thanks for listening. Please let me know if you have any queries with my teaching or with my teaching technique. If you are not understanding, if I am going too fast also, please let me know so that I can correct myself. Thank you so much. Thanks for listening. Please like, share, and subscribe the channel.